They didn't give her a commendation. They gave her a locked room and a man in a gray suit who kept asking the same question in different ways. The night it happened, Tessa Hale was 47 minutes into a double shift at Mercy Regional, standing in the break room with a cup of coffee she hadn't touched yet, staring at the wall the way you do when your body is still moving, but your brain checked out 2 hours ago. She was 31 years old, 5'4", and wore her dark hair in a bun so tight her coworkers called it the helmet. She didn't mind. She'd been called worse things by people who mattered more. Nobody at Mercy Regional knew much about Tessa. She'd transferred in from a clinic in Billings 18 months ago, kept to herself, showed up on time, never complained about the bad assignments. The charge nurse, a broad-shouldered woman named Paulette, said Tessa was the kind of person you didn't notice until you needed her, and even then, you weren't always sure you'd noticed her at all. That was exactly how Tessa preferred it. The radio crackled at 11:52 p.m. Paramedics inbound. GSW to the abdomen, possible internal bleed. ETA 4 minutes. Patient is military, active duty. No ID on him. 2 federal escorts. The ER shifted like a school of fish. Everyone moving at once. No collision. Just that particular organized chaos that looked like panic from the outside, but felt, from the inside, like a machine clicking into gear. Tessa set down her coffee. She moved to Bay 3 without being told. The man they wheeled in was large. Even bleeding out on the gurney, even with the color of old chalk, you could see what he'd been built for. His shirt had been cut away in the field. The pressure bandage over his left side was already soaked through. Not red anymore. That deep brownish red that meant time was not a negotiable variable. The 2 federal escorts came in right behind the gurney. One was a woman, 40s, short blonde hair, a posture like a flagpole. The other was a man with a jaw like a cinder block who positioned himself at the door and didn't move again. He's Army, the woman said to nobody in particular. Special operations. That's all you need to know. Dr. Priya Setharaman was the attending. She was good, fast hands, calm voice, and she started calling orders before the gurney stopped moving. BP, lines, type and cross, get me ultrasound now. Tessa was already gloved. She positioned herself on the left side, where the bandage was. The ultrasound showed what they were afraid of. Hemorrhage, significant, high in the abdominal cavity, near the aorta. Dr. Setharaman said the word everyone in the room was thinking, but nobody wanted to say out loud. We need to get him to the OR. Now, OR is 40 minutes out. Someone called from the desk. Dr. Castillo is in a thoracotomy. Dr. Nguyen is. I know where they are. The patient's pressure dropped. 80/50, then 74. The monitor made a sound that wasn't an alarm yet, but was heading toward one. Tessa looked at the numbers. She looked at the location of the bleed on the ultrasound image, still frozen on the screen. She looked at the rate of the drop. She did the math in her head the way she'd been taught to do it. Not in a hospital, not by any doctor whose name appeared on a licensing board, but in a different kind of school, in a different kind of room, a long time before she was Tessa Hale of Mercy Regional, before she was a floor nurse with a tight bun and a coffee she never finished. She counted backward from the moment they'd lose him. She got to 11. I can buy him time, she said. Dr. Setharaman looked up. What? The bleed is proximal. If I can place a balloon occlusion, you're a floor nurse. I know what it is. Tessa said it without heat, without defensiveness, the way you say the sky is blue or this room is on fire. I've done it before. I need a large bore Foley. I need fluoroscopy if we have it. And I need everyone who doesn't have a specific job right now to take one step back. The room went quiet in that particular way. Rooms go quiet when someone says something that either makes perfect sense or makes no sense at all, and nobody is sure yet which one it is. 61. That was his pressure now. The line was going in one direction. Dr. Setharaman was a good doctor. Good doctors know when someone in the room is right, even when they can't explain how. She looked at Tessa for exactly 2 seconds. Get her what she asked for. What Tessa did in the next 4 minutes and 20 seconds was not, strictly speaking, a standard nursing intervention. It was not something that appeared in the Mercy Regional Procedure Manual or in the continuing education modules the hospital sent out every January. What she did was thread a modified catheter into the femoral artery, advance it carefully into position, and inflate a small balloon that temporarily occluded blood flow just barely enough, to slow the hemorrhage without cutting off perfusion to the lower extremities. It was a field-expedient version of a procedure that had a long clinical name and was typically performed in a trauma bay by a vascular surgeon with 2 years of fellowshipped training and a very specific set of tools. She did it with a Foley catheter and her hands and something that lived in her muscle memory like a scar. The room was silent except for the ventilator and the monitor and the soft, efficient sounds of Tessa working. 72/45, then 78, then 81/50. He's stabilizing, someone said, as if they didn't quite believe the words coming out of their own mouth. Dr. Sethroman exhaled. It wasn't a loud sound, but everyone heard it. They got him to the OR at 12:09 a.m. Dr. Castillo came out of his thoracotomy and went straight back in. 4 hours later, the soldier, whose name they still didn't officially know, was in the ICU with a pressure that didn't require a prayer to maintain. Tessa stripped off her gloves, dropped them in the biohazard bin, and went to the sink. She was washing her hands when the woman with the flagpole posture appeared in the doorway. "I need 5 minutes," the woman said. "I'm still on shift, I know." 5 minutes. Her name was Agent Devon Cross. She showed Tessa a badge that Tessa recognized, not the agency logo, which anyone could look up, but the particular way Cross held it, the angle, the thumb placement, the half-second pause before she put it away. Tessa had been around enough people like Cross to know what the badge meant about the rest of the conversation. They went to a small consultation room off the main corridor. Cross closed the door. The man with the cinder-block jaw was not there, which meant he was stationed outside, which meant the conversation was going to be the kind that didn't benefit from extra witnesses. Cross sat down across the small table. She had a legal pad and a pen she didn't open. "Walk me through what you did in Bay 3. I performed a temporizing intervention to control hemorrhage pending surgical access. Using what technique?" Tessa described it in clinical terms. Concise, accurate. She watched Cross's face while she talked. Cross was good. She didn't react, but there was something behind the eyes, an assessment happening at a level the face wasn't reporting. "Where did you learn that?" The question that had been in the room since the moment Tessa started working on him. The question that had nothing to do with the patient's prognosis or the hospital's liability. The question that was really asking something else entirely. Tessa looked at Cross without blinking. "I read a lot." Cross didn't smile. "That's not a procedure you read about in a journal, Ms. Hale. It's Tessa." Tessa. Cross set down her pen. "I want to be straightforward with you. The man you just kept alive is not a person whose existence is officially acknowledged. His unit is not on any roster you could find through normal channels. The operation that resulted in his injury tonight is classified at a level that most of the people in this building don't have clearance to know exists." She paused. "So when a floor nurse at a regional hospital in Montana performs a high-risk vascular intervention that requires specific training to even conceive of, we have questions." "You have questions," Tessa said, "about the nurse who saved his life. We have questions about how she knew what to do." Tessa was quiet for a moment. Outside, through the wall, she could hear the normal sounds of the ER. A cart rolling, someone on a phone, the automated announcement system paging a doctor. The ordinary machinery of a place that dealt with the worst moments of people's lives and kept going anyway. She'd worked hard to be inside that ordinary machinery. She'd chosen it deliberately, the way you choose a quiet street in a quiet town after spending years somewhere very loud. "My name before it was Hale," she said finally, "was Tessa Kovar." Cross was still. "I went through the Special Medical Operations Qualification course in 2015. I was attached to a forward surgical team in Syria for 14 months. After that, a different assignment, different skills, different rules of engagement." She said it matter-of-factly the way you describe a previous job. "I separated in 2020. I wanted a different life. I got a different name, different paperwork, a floor nursing position in a town where nothing much happens." She looked at Cross. Tonight was an exception. Cross was quiet for a long moment. "Why didn't you disclose your background when you were hired?" "It wasn't relevant to the job." A floor nurse with special medical operations training is a person who needed to be somewhere quiet for a while. Tessa said it without apology, without explanation beyond what she'd already offered. I earned the quiet. Cross studied her. The legal pad sat untouched between them. The pen had never been opened. The man you saved tonight, Cross said slowly. His unit was operating on intelligence that was later determined to have been compromised. Someone in the chain fed bad information. He was the only one who made it out. Tessa didn't say anything. He may know who sold them out. Then you should hope he recovers well. We do. Cross folded her hands on the table. I want to ask you something off the record. Everything in this room is off the record. True. A pause. Did you know him before tonight? Tessa looked at the wall for a moment. The fluorescent light above them buzzed faintly, the way fluorescent lights do in every hospital in every city, that particular frequency that becomes white noise after a few hours. No, she said. It wasn't a lie. She hadn't known him. She'd known people like him. She'd served alongside people built the same way, who moved through the world the same way, who ended up on gurneys the same way. But not him, specifically. Not that face. Cross seemed to accept it. You're going to get a visit, she said. Not from me. From someone further up the chain who wants to understand how an asset with your background ended up at a civilian hospital in Montana. She said it without threat, but the information in it was not comfortable. I'd recommend you have your documentation in order. My documentation is in order. My documentation is in order. I know. I checked before I knocked on this door. Cross stood. She was taller than she'd looked sitting down. For what it's worth, what you did tonight. The technique, the speed, the decision to act. She stopped. Seemed to choose the next words carefully. Most surgeons I've seen in the field wouldn't have moved that fast. Most surgeons haven't worked in the field. Cross nodded once. Then she opened the door and walked out, and the man with the cinder-block jaw fell into step beside her without a word. And they were gone down the corridor, and the ER noise filled in behind them like water over a stone. Tessa sat in the small consultation room for another minute. She thought about the qualification course, about a particular afternoon in a converted barn in Virginia where a man named Sergeant Duval made her practice arterial cannulation until she could do it in the dark, in the rain, with her hands shaking. You will do this until it is the most boring thing your hands know how to do, he'd told her. Because when you actually need it, everything else will be very loud and very fast and very ugly, and your hands need to already be there. Her hands knew how to be there. She got up. She went back to the floor. Paulette looked up from the desk when she came out. They done with you? For now. You okay? Tessa thought about the question. The real answer was complicated. The short answer was easier. I could use that coffee I left in the break room. Honey, that coffee is long dead. I'll make new. She made new coffee. She went back to work. Bay 1 had a 60-year-old with chest pain who turned out to be anxiety, which happened more than people thought. Bay 2 had a kid who'd put a Lego up his nose, which also happened more than people thought. Bay 5 had an elderly woman with a broken wrist who kept apologizing for being a bother. And Tessa sat with her for a few minutes longer than strictly necessary, because the woman's hands were cold and she seemed scared, and sometimes that was the job too. At 3:40 a.m., she got a page from the ICU. She took the elevator up. The night was quieter on the 4th floor. Machines, mostly, and the particular hush of people sleeping in ways they hadn't chosen. The soldier was awake. He shouldn't have been. His chart said he'd been under sedation. They were going to ease him out slowly in the morning. But he was awake, and his eyes were tracking. And when Tessa came through the door, his gaze found her immediately, the way trained eyes always find the person who just entered the room. She checked his vitals. She checked his lines. She adjusted the drip rate on one of the bags without looking at the label, because she'd already memorized his chart. You're the one who did it, he said. His voice was rough from the intubation, but it was steady. You were awake for part of it? She asked, not turning from the IV pole. Just the end. Enough. A pause. Felt the pressure change. Knew someone got the bleed. Your surgeon did the hard part. He told me what you did. Before the surgery, he said. The man stopped, seemed to reassess, seemed to decide something. He said he'd never seen it done outside a trauma bay, not by anyone who wasn't specifically trained for it. Tessa turned and looked at him. He was maybe 36, 37, the kind of face that had been outdoors a lot. There was a scar along his jawline, old, from before whatever tonight was. "Get some sleep," she said. "What's your name?" She considered not answering. Considered the 2 federal escorts, the locked consultation room, the woman named Cross, who knew her documentation was in order because she'd checked it first. Considered what it cost to keep a quiet life quiet when things like tonight kept happening. "Tessa," she said. He was quiet for a moment. "I would have been dead. I know. That doesn't seem to be a very big deal to you." She thought about how to answer that. She thought about 14 months with the forward surgical team, and what it cost to let it be a big deal every time, and what it cost not to. "It's a big deal. I just don't need it to be loud." She dimmed the light above his bed. She walked back to the door. "Tessa," he said behind her. She stopped. "Whatever they asked you in that room, whatever they want from you next." He paused, and his voice had something in it that wasn't gratitude exactly. It was older than gratitude, more worn in, the way soldiers acknowledge debts that can't be repaid. "You should know you're not alone in it." She stood in the doorway for a moment. The hallway light caught the side of her face. "Get some sleep," she said again, and walked back to the elevator, and pressed the button for the first floor, and went back to work. The sun came up at 5:47 a.m. Tessa knew, because she watched it through the window above the nurse's station sink, the way she always did when she worked the overnight. The sky went from black to a particular shade of gray-purple that lasted about 6 minutes before it committed to anything, and she always thought that was the best part. The moment before the day made up its mind. She clocked out at 7:15. She drove home in her 10-year-old Subaru with the cracked rear bumper. She made actual breakfast for the first time in a week. Eggs, toast, the last of a jar of salsa her neighbor had left on her porch 2 months ago. She sat at her kitchen table and ate it looking out at the mountains, which were doing what they always did, which was not caring at all about anything that had happened in Mercy Regional last night. She'd get the visit Cross had promised. She knew that. Someone further up the chain, asking better questions, maybe already knowing some answers. She'd have that conversation when it came. She'd say what was true and leave out what didn't need saying and walk out of the room the same way she always did, on her own 2 feet, heading back toward whatever quiet she could put back together. She washed her plate. She went to bed. Outside, the mountains held their position, exactly as they'd been for 10,000 years, large and indifferent and permanent, waiting out whatever came next.